And I'm joined this afternoon by Commissioner Jean Lambrou, Commissioner of Maine's Department of Health and Human Services. Commissioner Lambrou and I are delighted to be with everyone today to provide an update on COVID-19 and other healthcare policy changes going on across the state of Maine for today, October 27th, 2020. I'll start with a COVID-19 outbreak update and then turn things over to Commissioner Lambrou. Right now, across the state of Maine, there are a total of 6,311 cases of COVID-19, an increase of 57 new cases since yesterday. Of those cases, 5,593 are confirmed, an increase of 42 confirmed cases, and 718 cases are probable, an increase of 15 probable cases. Cumulatively, 479 individuals have been hospitalized at some point, and in the past 30 days, 29 individuals have been hospitalized. Right now in Maine, 12 people are currently in the hospital, 7 of whom are in the ICU, and none of whom is on a ventilator. 146 individuals have passed away with COVID-19, and 5,398 have recovered. Among our cases are 1,136 healthcare workers. Just to provide a bit more color around the recent cases that we've seen, of the cases reported to Maine CDC yesterday, approximately 24% were among individuals in Cumberland County, 23% among individuals from Kennebec County, and 21% were among individuals from York County. What's concerning, and what we'll talk about in a bit, is that we're also seeing cases in other parts of the state that previously had few cases. For example, there are now a total of 48 cases cumulatively in Washington County, which has experienced a significant increase of cases. 32 of those 48 cases have occurred just this month alone. I'd like to take a moment to discuss some of the outbreaks in which Maine CDC is most active. We'll first start with 2 new outbreaks and outbreak investigations that we have opened. One is at the Second Baptist Church in Calais, where there are a total of 4 cases thus far. We are working with the Second Baptist Church to determine whether there may have been other individuals who have been exposed and who may potentially receive testing. We'll have additional updates on those matters as our investigation continues. We've also opened an investigation into the Woodlands Memory Care Facility in Rockland, where there are a total of 3 cases right now. We strongly expect that there will be additional cases in the coming days as that facility conducts and receives the results of their universal testing. I will note that we are very concerned about this outbreak at this particular facility based on our experience working with another memory care facility earlier this summer. As we learned during that outbreak, this is a particularly vulnerable population and one, again, in which we sadly expect that there may be more cases as the testing process starts yielding results. As we have results from that testing, we will make sure we update everybody, again, as our investigation unfolds and as testing results come in. Also, at the outbreak that is widespread across Waldo County, initially associated with the Brooks Church, there are now a total of 60 people who have been diagnosed as positive with COVID-19 associated with that outbreak. One note there, the outbreak at the Woodlands Memory Care Center that I just noted is not at this time thought to be connected with the Brooks Church outbreak, but that is a question that our investigators are examining. In addition, some of the other facilities that I've noted that were connected with this outbreak, although they remain connected, they themselves have not yet reached outbreak status. So for example, the Bayview facility, as well as some of the church schools, however, that I've mentioned, although there continue to be 1 case or 2 cases associated with those facilities, they themselves have not reached their own outbreak threshold. But again, as the investigations continue both into the Waldo County situation as well as into the Woodland memory care situation, it's possible that we may identify linkages among those various situations. And finally, an update on our testing numbers. Right now in Maine, the positivity rate on a 7-day basis is 0.66% for PCR tests reported to Maine CDC. Our testing volume stands at 440 tests for every 100,000 people that are currently being conducted across the state of Maine. Before I turn things over to Commissioner Lambert, I wanted to take a moment to provide some context around some of the numbers that we've talked about just today alone. Today marks the 3rd day in a row that in Maine we have seen more than 50 new cases of COVID-19. 64 new cases on Sunday, 53 cases yesterday, and now 57 cases today. 174 cases in just 3 days. Unfortunately, we expect that the number of new cases per day will continue at this rate and likely move even higher in the coming days. Our positivity rate has increased from 0.45% 2 weeks ago to 0.66% today. Even though that number remains low relative to other states, relative to the country, and the fact that that number puts us in a good position to detect new cases, the increase that we've seen in our positivity rate, coupled with the relatively stable testing volume, also means that more transmission of COVID-19 is occurring in Maine. The spike that we have foreshadowed is happening, and this is deeply concerning. The bottom line is that we are in it now. These numbers should hopefully put to rest any notion that it can't happen here, it can't happen in our state, it can't happen in our county, and it can't happen in your town. It can happen here because right now it is happening here. What's concerning is that the cases that we've seen recently are being driven not by large focal outbreaks, but by community, even household level transmission in virtually every corner of the state. Almost every day, we see new cases in almost every county. This is significant because from a disease control perspective, it's much harder to tamp down on community transmission than it is an outbreak. The uninvited guest that we have discussed is not just in one nursing facility or in one hospital, but it's now in multiple homes, places that we have all previously looked to be as safe havens. These facts, unfortunately, make COVID-19 more concerning and sadly riskier for all of us, especially those in rural areas. It also makes it that much harder to address. The coming weeks will be a challenge, but as daunting as that challenge before us is, we can do it. Maine has risen to challenges repeatedly since March of 1820. Since then, we have adapted to worlds that have turned upside down multiple times. We've learned to work differently, learn differently, and now socialize differently. But let's just acknowledge that what complicates things right now, what makes things hard right now, is that we're tired. What started out as us being scared turned into us being bewildered and has now settled on something close to fatigue. I think it's important that we just acknowledge that. But the state of Maine, indeed our entire country, have done hard things. Just in the world of infectious diseases, we have done and tackled hard things. Imagine what the world would have said if the people who were dealing with smallpox or polio eradication had said, if they had just said, you know what, we're tired, we can't keep this up anymore. The fact is, those folks didn't say that. They powered through. we can do the same thing here. For me, the trick isn't to remember just what we're doing, but why we're doing it and for whom we're doing it. We're doing this to care for our elderly, to keep our kids in school, and to protect vulnerable families across our state. I think it's also important for me to remember, at least, that the measures that cause us this fatigue, mask wearing, physical distancing, not being able to see our friends and family, those same measures are the same vehicles that allow us to resume activities in a stepwise fashion. My bottom line today is that Maine is at a critical juncture. Our response now will determine our success going forward. But the horse is getting further and further away from the barn. So what can you do? Well, given the rise in cases and given the concerning signs that we see on the horizon, it is now, today, more important than ever to wear a mask, to stay 6 feet apart, and if you're congregating indoors, do those same things as you would have done outdoors, plus allowing for proper ventilation. We have an opportunity in front of us in Maine. We've got to make sure we take that opportunity and not throw away our shot. So with that, I'd like to turn things over to Commissioner Wambrew.
Thank you, Dr. Shah. Yesterday, the federal government released new data that show that most people in Maine can pay less than $75 per month for coverage through the Affordable Care Act's health insurance marketplace in 2021. The health insurance marketplace, also called healthcare.gov, is a website where people buying insurance can compare plans, see if they qualify for extra financial help, and sign up for coverage. 60% of Maine's healthcare.gov customers this year qualify for a plan costing under $75 a month. 40% can pay for a plan for less than $10 a month. And now 86% of Mainers buying coverage through the marketplace qualify for reduced premiums. The average premium in the individual health insurance market in Maine will be 13% lower next year compared to this year. Maine is one of only 4 states where the average premiums are dropping by more than 10%. This is the 3rd year in a row that premiums have actually fallen rather than increased in Maine. Open enrollment on the health insurance marketplace begins on Sunday, November 1st, and ends on Tuesday, December 15th. People eligible for Maine Care, our state's Medicaid program, can sign up at any time during the year. Maine people can explore both options at coverme.gov. As Governor Mills stated, no one should have to live in fear of not being able to see a doctor, not being able to fill their prescriptions, or receiving life-saving care, especially in the middle of a pandemic. As we continue to respond to COVID-19, health insurance is more important than ever. Even if you may only need coverage temporarily, or your employment situation remains uncertain, it's worth signing up for coverage. That way you can make sure your family gets a checkup, you can afford your medications, you can access other needed health care. This year, Maine is taking a greater role in running its marketplace. Consumers can still shop and apply for coverage through healthcare.gov. This year, however, the Maine Department of Health and Human Services is taking over enrollment assistance and outreach, thanks to the governor's Made for Maine Health Coverage Act of 2020. This bill passed with bipartisan support and was signed into law by the governor in March. As a result of this transition, the department has doubled the grant award for navigators. These are people who provide free, unbiased assistance to consumers applying for both private marketplace coverage as well as Maine Care. Additionally, the Maine Department of Health and Human Services will launch digital, TV, and radio advertising to make sure Mainers are aware of their coverage options. New law is also improving coverage for all people with state-regulated insurance. You'll be able to get easier access to primary care and behavioral health coverage through your private insurance plans. Today, people can preview the health plans available to them on the marketplace at healthcare.gov. 3 insurance companies are offering 56 different plans through the marketplace for 2021. You can also call for information at no charge at 1-800-965-7476. That's 1-800-965-7476. Check out your options at coverme.gov today. With that, I'll turn it back over to Dr. Shah for questions.
Great. Thank you, Commissioner Wambrew. We'll turn now to our colleagues in the media. And the first question for the afternoon goes to Emily Tadlock from WABI.
Hi, thanks so much, Dr. Shah, for taking my question this afternoon. I want to ask about, obviously, everyone knows that President Donald Trump visited Levant on Sunday, and I was just wondering if there's any concern. Thousands of people showed up for that event. Many of them were unmasked. Is there any concern for the CDC right now? Have you heard of any cases being linked to any individuals who've attended that event?
Thanks for that question, Emily. We have not yet detected any cases, but let's be clear, the event just occurred and it can take a while for cases to materialize. Individuals have to start experiencing symptoms, which can take 3 up to 5 days, then get tested, and then have those results reported to Maine CDC for investigation. So it's too early at this juncture to tell whether any new cases that have been reported recently can be tied yet, but we are on the lookout for those. What we've seen in other states is that any large gathering, irrespective of the purpose for which the gathering was organized, if folks are coming together in close proximity, especially where face coverings aren't being worn, there can be the possibility of transmission and other cases being generated. So with any gathering, if you are planning to attend, we strongly encourage you to wear a face covering and maintain distance from others. Those are the steps that can reduce the likelihood of transmission. I'm going to turn next to Abby Curtis at the BDN.
Hi, Dr. Shah. Thank you for taking my question. I'd like to ask about the Waldo County outbreak. For the last few days, our daily numbers have seemed fairly low. Does this seem like a sign that the outbreak may be under control? And I have a follow-up to that, but I can ask it now or later.
Okay, sure, Abby. I'll start with that. Although we are encouraged that the numbers of cases associated with this outbreak have not risen steadily, we're not out of it yet. What we've seen in other outbreaks, for example, one that occurred in August and September, connected in similar fashion, that starting in Millinocket, what we saw in that outbreak and what we've seen in numerous other outbreaks is that individuals who may have been initially part of the, say, Brooks Church can seed an outbreak that takes hold somewhere else. That may not happen immediately. It can take an extra week or two for that degree of transmission to happen. So we're not out of this yet. We strongly and continue to encourage folks who are in the Waldo County area, if you're experiencing symptoms that could be COVID-19, cough, fever, shortness of breath, rapid loss of taste or smell, please get tested. Testing is available in Waldo County at Penn Bay Medical Center, at the Waldo County General Hospital, at the Seaport Community Health Center, among other places. If you're having symptoms, please make sure you get tested.
Thank you. And a brief follow-up. Have most of the cases in Waldo County that are connected to the church outbreak, are those primary, I'm not sure, primary transmission, or has there been a lot of secondary transmission cases as well?
The bulk of the cases, and we'll get you the latest numbers as of this afternoon to make sure you've got the most accurate and up-to-date figures. The bulk of the cases have been individuals who are primary cases. That means they either attended the fellowship service that occurred earlier in the month or attended a worship service that was connected with Brooks. There have been, again, some secondary cases, and we'll get you the latest numbers on those.
Thank you very much.
I'm going to turn now to Allison Ross at WMTW.
Hi, Dr. Shah. Thanks so much for taking my question. So just taking a little closer look at these numbers. So we're seeing this spike in new daily cases, but we haven't seen a death, luckily, since it's been pretty much over a week. So does that imply that it's younger people getting and spreading this virus?
So, Allison, it doesn't imply that. It also happens to be the case that the average age of individuals who are getting COVID-19 in Maine and across the country has trended lower. There are different reasons for that. One reason is that the virus has started affecting younger folks starting in the summer as more individuals were resuming economic, social activity, more younger people were in the path of the virus. It's also important to note that as testing has expanded so significantly in Maine, younger people are now getting tested as well. So it's a little bit of both, but there's certainly an element of more transmission. With younger people getting infected, younger individuals do have, thankfully, a lower fatality rate. But what I think is really important is that even though their fatality rate is lower, it is not zero. We have had individuals in Maine who are younger who have died with COVID-19. So it can affect younger individuals, particularly if they have underlying health or medical conditions. I'm going to turn now to Evan Popp at the Maine Beacon.
Thank you. So it was reported that White House contact tracers have contacted at least one person in Maine about possible COVID exposure at a rally held by Vice President Pence recently. And I was wondering, how involved will the Maine CDC be in doing contact tracing for that event? And has there been any contact with contact tracers at the White House in terms of coordinating that?
I can only speak to the Maine CDC side. I can ask the commissioner to weigh in as well. But as to the Maine CDC side, we are aware of that communication. That individual well, what I will say is we Maine CDC have not been directly contacted by the White House, but any case that we are aware of that is reported to us, we investigate and then make sure we have worked with them, that individual case, to understand where they have been and any individuals they may have come into contact with so that we can do our standard contact tracing.
So you would be involved in doing contact tracing for that event?
If a case is reported to the Maine CDC, we investigate that case and work with that individual case to understand who their close contacts are so that we can put them into our contact tracing program. But the case has to be reported to Maine CDC.
Okay. And then also just kind of a follow-up on the rallies that were held by the president and the vice president in Maine recently. So, I mean, they've been holding rallies in many places around the country, obviously. And some of those places have seen spikes in COVID cases, some of them have not. Is there anything that you've learned or that might be something that could be applied in Maine in terms of whether or not those rallies lead to COVID spikes or not in other places?
Yeah, Evan, I think what we've learned through the summer since March is that the factors that drive potential transmission of COVID-19 really come down to the things that we've thought about as we've thought about other gatherings, which is the duration and the density. Any gathering that is of long duration and where there's a high density of individuals packed into an area has the potential for COVID transmission. That potential is magnified if individuals are not wearing face coverings. Even with face coverings, there is a possibility, but the face coverings lower that possibility. So I think what we've learned is that individuals who are thinking about attending any gathering of any sort, no matter what the purpose of it is, should take steps to protect themselves and to protect others that they may be going to interact with. The best way to do that is to wear a face covering and maintain at least 6 feet of distance from everybody there.
Thank you.
I'm going to turn now to Patty White at Maine Public.
Thanks, Dr. Shah. You've been talking about the importance of wearing masks inside, even at small household gatherings. And the guidelines for churches say that face coverings should be worn when physical distancing is difficult to maintain, which makes it sound like it's okay not to wear a mask if you're 6 feet apart from people. Given that we've had several outbreaks that involve churches and all the concern about activities moving indoors and greater transmission of COVID, is the state going to update its guidelines for churches and require masks at all times?
Yep. Oh, sorry, Commissioner, go ahead.
So We'll double check that checklist. As a reminder, the executive orders are overarching, and our executive order on face coverings applies to any space where the public gathers. That does include houses of worship as well as retail establishment and others. So we do believe that our face covering executive order applies, and we'll double check to make sure that that's reflected in that religious gathering guidance.
Mm-hmm.
Okay, thanks. And the new daily cases, as we all know, are going up in nearby states that are included in the exemption for coming to Maine, places like Massachusetts, New Jersey, and Connecticut. Is the state considering taking any of those states off that list?
We review the status of other states in New England nationwide regularly. They are on our radar screen. We're looking very closely at what's going on in their positivity rates, their new case rates, underlying transmission, and we expect to be seeing if there's any changes needed to our guidance on quarantining and testing for people traveling to and from those states.
Thanks, Patty. I'm going to turn now to Amy Brown at WERU.
Thank you, Dr. Shah. Just following up on the issue about the White House contact tracers, if the White House did not let the Maine CDC know about that directly, how did you find out, and does that pose a possible problem given the number of potential super spreader events that have been held by their campaign across the state in recent days?
Amy, we don't comment on individual or particular cases. What I can say is that after we were made aware of this situation, we did the diligence that we would do as if this were a case that had been reported to us, but we don't comment or weigh in on individual cases.
So are you saying then that you heard about it through an individual rather than through any official means? That's what I'm trying to determine. Was it some kind of official capacity that someone got in touch with you to let you know about this?
We were not informed of this case by anybody from the federal government or from the White House.
Okay.
Mm-hmm.
I have a question from a listener who lives in Waldo County, and I don't know if this is for you or Commissioner Lambrou or both of you. The listener says that they have recently learned that RSU 71 in Waldo County is planning to resume their regular class schedules effective tomorrow. And they say that the technical center in Waldo County never changed their schedule in light of the governor's designation of the county as yellow. And they wanted to hear your thoughts about that.
So our job here at the Maine Department of Health and Human Services, in partnership with Maine CDC, is to provide health advisories. These advisories are based on quantitative data, qualitative data, a holistic look at what is going on in a county, and it's designed specifically for the purposes of school leadership, making the decisions for their own districts about whether learning should be all remote, hybrid, or all in person. We recognize that counties are sometimes big, that school circumstances are different, that different schools have different capacities to space out students and faculty, to use different gyms and other auditoriums for classroom teaching. So there really is no one-to-one correlation between these health advisories and what should happen in a school district. All that said, when we put these health advisories up, is we're giving those school leaders a warning, a heads up that in our estimation, something is going on in that county, so they should look hard at their plans and make decisions accordingly.
Thanks.
Going to hand things over to Joe Waller at the Press Herald next.
Yes, hi. I have two questions. With the increasing cases over the last week or so, are you planning to revisit having bars reopen on November 2nd? And if not, why? What's the reasoning behind that?
It's a week out from November 2nd. We are still looking hard at the data, recognizing the fact that the circumstances have changed since we made that recommendation. We do appreciate the fact that we try to be as predictable as possible with our business partners to give them that heads up. with a caveat that we are always putting public health at the forefront of our decision making. So we are trying to figure out how to strike that balance between public health and reopening. And in light of recent increases in cases in Maine, we're looking hard at that start date. But we had no decisions to announce at this time.
Okay, thanks. And my second question is just on about youth and high school sports. If there's any update on winter high school sports, what's the latest deliberations on that? And also what you think of the Maine Amateur Hockey Association going ahead and playing games against the recommendation of the of DHHS. Thanks.
So on the topic, actually, I think I'll answer in reverse order, starting out with the Maine Amateur Hockey League proceeding with sports. As a reminder, our community sports guidance is what we recommend for all the different private leagues to follow this fall with fall sports. We have continually urged the organizers of those events to follow those guidelines on face coverings, on competition, as well as distancing. And we also urge parents and the players to look hard at those guidelines as well. We're doing this to protect them, to protect their families, to protect their communities. So we really hope that the participants in these sports leagues really do take these guidance seriously. We have been consulting with our colleagues and counterparts in different New England states. As you all may know, Vermont, New Hampshire, and Massachusetts have limited hockey games because of outbreaks. We are conferring with them to see what they've learned, what practices work, what practices don't work. And we also, in the context of refreshing our sports guidance overall for winter sports, are seeing where there's gaps, where there's room for improvement. So to the first part of your question on winter sports, we are looking at what the expert guidance says, what other states are doing, what leagues are doing, as well as conferring with Maine Principals Association, superintendents, as well as school boards, because a lot of the work that has to happen is in those school spaces. We are hoping that we can begin to give information to people who are planning for winter sports in the near term, but we want to do so carefully and together. So when we go out with this guidance, which will more closely align community sports with school sports guidance, so there's less daylight between the two of them. When we go out with that, we hope we will do it well and comprehensively with evidence and with guidance for all those parents, athletes, and schools, as well as organizers of sports, to give them the tools they need to keep people safe from the spread of COVID-19.
Thanks, Joe. I'm going to turn next to Sarah Dedman from the Machias Valley Observer.
Thank you, Dr. Shah. As you mentioned, Washington County is reporting quite a few new cases right now, and most of those have happened in the last 2 days, and we have our first hospitalization. I see the CDC's 14 and 28-day data tables will be updated later this week, but at this point, does this look like community transmission?
Sarah, the numbers determine where we are and when we reach different thresholds of community transmission. You'll note on our website that we recently adopted a framework that the CDC put forth and made it applicable to Maine that specifies not just when there is community transmission, but the varying degrees of intensity of community transmission. As you noted, we do update those data. This isn't a qualitative judgment. It's a quantitative one that proceeds according to what those numbers are. I can't speculate as to what this week's 14 or 28-day numbers will be, although there's been an increase in cases. To be sure, it's not just the raw number of cases, but adjusted for the population as well. So it's a risk, it's a concern. We remain concerned about Washington County. We are even more concerned now, given the recent increase. Where it fits into those various thresholds and slots in the community transmission architecture, that's something we'll see when the data are finalized and come out. But we shouldn't wait for that before we really underscore that the growth in cases in Washington County is concerning. It's a small, tight-knit community, and those are the things that make Down East great, small, tight-knit communities. But they can also be the conditions under which COVID can spread. So if you're down in Washington County, if you're down east anywhere, please take steps to keep you and your family safe.
Great. I have one more question. Thank you. I believe there's still an open outbreak associated with the Woodland Mill, and I know that has sort of it'll time out at 28 days, hopefully, but so far has contact tracing found any of our new cases to be associated with the mill?
Great question, Sarah. Just for factual purposes or just a level set, there are a total of 18 cases right now associated with Woodland Pulp in total. As of right now, we have not associated any of the cases in the past 8 days or so, maybe 10 days. I can go back and check. We haven't associated any of the cases that have occurred quite recently with Woodland Pulp. That situation seems to have been in a little bit of stasis. What we're seeing in Washington County, without going too much to compromise confidentiality, what we are seeing in Washington County is not related to workplaces, but related to what I noted, which is household transmission from groups, gathering, and social settings.
Thank you.
Going to turn next to Hannah from News Center.
Hi, Dr. Shah. Thank you for taking my question. COVID-19 infections spreading across the country right now at the fastest rate since the start of the pandemic. While the numbers in Maine are still relatively low, speaking broadly, can you speak to the preparedness of our testing facilities and our hospitals in Maine for the potential of a significant surge?
Sure thing, Hannah. I'd be happy to. And Commissioner Lambrou and I work very, very closely on these issues. So I'll start and certainly invite her to chime in. You know, you focus in on the hospitals, and I'm glad that you do, because although hospitalization rates have ticked up very slightly, they are not at the levels that we have seen in Wisconsin, North Dakota, Great Plains, and Upper Midwest states. That's thankful. However, there is still the possibility that there could be a spike in hospitalizations. Even in those states, the spike in hospitalizations followed the spike in cases by roughly 10 to 12 days, 10 to 14 days. So we are anticipating, if not certainly preparing, for the possibility that there could be an increase of hospitalizations as well. That's why we've been working with hospitals very, very closely on a couple of fronts. The first is to make sure they have all the PPE that they need so that they can keep healthcare workers as well as other patients safe. We're also working with hospitals to make sure they've got all the testing supplies that they need so they can test patients with the swabs and the vials of saline that they need to do all the testing. We're also working with hospitals, continuing to work with hospitals on scenarios under which we hope don't happen, but we have to be prepared for, which would be scenarios as happened in Wisconsin, where they had to dust off their plans to open up even more hospital beds. We hope that doesn't happen in Maine, but as we've said before, hope is not a strategy when it comes to COVID-19. Preparedness is the strategy. If that spike were to happen and hospitalizations were to increase, we would be prepared for it, not recognizing how incredibly challenging and hard it would be. I'm going to turn next to Anne from the Ellsworth American.
Thank you, Dr. Shah. I have two questions. First is, following the recent Trump appearance in Levant and other large gatherings like that appear not to be held within CDC guidelines, what resources do employers have if their employees attend for maintaining workplace safety in public-facing buildings, in particular healthcare facilities?
I think there's a few ways to think about that, Anne. The first is to think about the workplace as, irrespective of whether an employee happened to have attended a large mass gathering, the same conditions that keep people safe in the workplace, whether or not someone has attended a gathering, should be the ones that everyone is applying right now, making sure that the workplace doesn't become a site of transmission. This includes making sure workplaces can accommodate physical distancing, that face covering wearing is the norm, that sanitation and cleaning protocols are followed. That's the best thing that workplaces, employers can do right now to keep folks safe and reduce the likelihood that anybody who's been to a mass gathering might introduce it and transmit it. Those things aren't foolproof, but that's the best place to start. Commissioners, or anything I missed there?
No, you answered that perfectly. Thank you. My second question is on a different topic, and it has to do with Maine's positive test results. So when you get positive test results from out-of-state residents who are living in Maine, they're not currently reported by county for Maine. Will that happen in the future?
If Maine CDC receives test results for somebody who is living in Maine, they are counted in our numbers. If a test is done in another state, in another laboratory, for someone who is currently living in Maine and as a Maine resident, those are counted in their numbers, in our numbers, and listed in the county of their residence.
Is there any circumstances where a positive test case from someone tested in the county, whether or not they're a resident, is not counted and reported by county?
I suppose if someone were a tourist who happened to come here and take advantage of one of our swab and send sites, for example, because they weren't feeling well and started developing symptoms, and they went on the governor's COVID page or on the Get COVID-19 testing page because they weren't feeling well and wanted to get tested ASAP, if they gave their home address as being from another state, that in that situation, the result would be reported to Maine CDC because swab and send sites are operated by the state of Maine, but we would simultaneously report that result to the health department of the state in which they indicated their residence. But that would be an example, again, of a tourist who happened to be here for a short period of time.
So what I'm hearing you say is that every positive case that's done in Maine, that's tested in Maine, is reported by county at this point?
Provided the person is a Maine resident and declares their residency in Maine. And that has been the case since we started doing testing back in March. That's the protocol that we, and as far as I'm aware, every other state uses. That's in accordance with US CDC guidelines on how not just COVID, but all infectious diseases are reported to states as well as up to the US CDC.
So I'm not asking the question right, I think. So I think what I'm asking is if it's someone who does not declare Maine as their residence, but the positive test comes from Maine, when they are in Maine, will that be reported by county?
If someone doesn't declare their residence as Maine, but comes to Maine and gets tested, which some folks do, for example, folks from New Hampshire may seek healthcare in Maine, which occurs quite frequently. Folks from New Hampshire can drive across the border into Maine and seek healthcare. If those tests are done at the Maine CDC laboratory, which our swab and send sites are, those still get reported to the Maine CDC, but also then get transferred to the state of New Hampshire. If that test is done on an outside laboratory, say Quest or LabCorp, those labs will report the result directly to New Hampshire because that person lives in New Hampshire, even though they may have driven across the border for a few minutes to get tested. Their home state is the one that receives those.
Thank you, Dr. Shah.
I'm going to turn next to Steve Porter at Seacoast.
Thank you, Dr. Shah and Commissioner Lambrou. My question is about the death of Jason Daigle, who was incarcerated at York County Jail when he experienced a medical issue last month, then died September 20th. The Office of Chief Medical Examiner identified a stroke as Daigle's primary cause of death, but also identified COVID-19 as a contributing factor. Could you explain what your team does with this type of determination from the medical examiner and whether Daigle's death will be reclassified as a COVID-19 death?
It will not be reclassified. Maine CDC answers one question. The medical examiner answers a different question. Maine CDC's question is, did somebody die with COVID-19? After somebody has been deemed to be recovered from COVID-19, they have not, if they happen to pass away, they have not died with COVID-19. The medical examiner's office, after conducting an autopsy, asks a separate question, which is what did the person die from? In this case, based on what we understand, the medical examiner concluded that this individual, Mr. Daigle, died of a hemorrhagic stroke. And although the person had COVID-19, it was not the cause of death. I think the basic answer there is that we are asking different questions. We are asking when somebody has died with COVID-19, after you've recovered, you no longer are considered to have COVID-19. The medical examiner's office is asking a different question. The two are not in conflict with each other in any way. Let me also just say that none of this discussion at all erases or even for a second diminishes the importance of the individual's life who has passed away. We all collectively mourn Mr. Daigle's life. And the discussions that we're having about whether with COVID, from COVID, during COVID, after COVID, don't for a second erase the value and the sorrow that we have for his passing.
So what is your read on the literature that has suggested a possible heightened risk of perhaps heart attack or stroke among those who have experienced COVID-19? Do you, what expertise can you share with the general public who may not be able to really read and digest that type of literature?
Well, Steve, what you got to make sure we keep in mind is that there are two types of strokes. There are ischemic strokes and there are hemorrhagic strokes. Ischemic strokes happen because of blood clots, and those have been associated with COVID-19. But there's another large category of strokes called hemorrhagic strokes. That is when someone has a bleed in their brain. To my knowledge, I have not seen data that suggests there is a strong connection between COVID-19 and hemorrhagic strokes. That there may be. There is a wide literature in the neurology and neurosurgery world that is studying this and evaluating this. At this time, I have not seen a connection between those. That doesn't mean there's not one. There could be. It doesn't mean that there won't be one. There may be in the future. But at this time, I'm not aware of such a link.
Thank you.
I'm going to turn next to Rachel Mann at ABC 7.
Hi, Dr. Shah. I was just wondering, are there any repercussions for frontline healthcare workers who attend gatherings of hundreds of people without facial coverings, or do you have any words, I guess, for people that should be setting a better example?
I don't think we're going to really comment on repercussions that employers may have with their employees. That's really a better question for employers and hospitals themselves. I think what I would say is that no matter who you are, no matter what line of work you're in, if you're attending any kind of gathering, no matter what the purpose is, do the right things, wear face coverings, and stay physically distant apart. Commissioners, anything we should add to that? Okay. And the final question of the afternoon today goes to Patrick Whittle at the AP.
Thank you very much. I have a pair of questions that are quite different. Question the first is, if we could get sort of a final update on the Maple Crest outbreak, which appears to be closed. I would love to know from either you or Commissioner Lambrou or both of you, sort of what the status is there and if they've submitted a new final plan or anything like that. And additionally, question the second, we've seen a sort of a growing body of science about the role that vitamin D plays in COVID survival. And I think I've annoyed you already. I'm sorry. And we're here in a state where the sun doesn't always come out. As much as we all love Maine, that's a limitation here. So I'm curious if there's anything we should know that's sort of unique to Maine regarding COVID and vitamin D.
Okay, we'll start with the first one, Patrick. And you have not annoyed me. It's just a question that comes up in medical and epidemiology circles all the time. Let's start with Maple Crest. We'll get you the exact case numbers, the final counts of the numbers of cases associated with Maple Crest. I want to make sure I get you the latest number as of the time it was closed. So we'll get that for you ASAP. But you also asked about other mitigation steps. Commissioners, anything else to add there?
Sure. Well, we are very grateful that the outbreak has closed at Maple Crest. There were deficiencies. They were cited for those deficiencies. They have been working on their corrective action plan, and we continue to work with them because our goal is not just to look back, but to look forward, to look to the present and make sure that every resident in a nursing facility in the state of Maine is safe. So we do continue our work with Maple Crest and all of the nursing facilities across the state of Maine because COVID-19 remains here. It remains the same threat that it was in March. So our vigilance in nursing facilities needs to remain high.
And Patrick asked to vitamin D. It's interesting. Vitamin D is one of those vitamins that's in vogue right now. And it seems like no matter their condition, whether it's COVID-19, psoriasis, dandruff, arthritis, you name it, there's a study that someone is out there doing to see if vitamin D might be the panacea. There have been some interesting findings that have correlated vitamin D levels with lower rates of COVID-19. My quick read is that those have a major confounding variable, which is that folks with higher vitamin D levels tend to be outside more, which, as we've talked about, means that you are less likely and you have greater protection against COVID. So right off the bat, there is a major confounding variable that those studies have to account for. There's a recent paper about 2 weeks ago that took a little bit more of a deeper analysis, but it too was flawed because it looked at people who had low vitamin D levels and then looked to see what their COVID likelihood was. But it seems to have forgotten the fact that if you have low vitamin D levels, you probably have other health conditions that could predispose you for having COVID-19. So as of right now, Patrick, although there are interesting hypotheses and they are intriguing hypotheses, they are in line with right now what is a march of studies that are hoping that vitamin D becomes the panacea for something. We're not there with respect to COVID-19. If your doctor has told you that you've got a low vitamin D level, then you should do what your doctor has said, which is probably to take vitamin D. If your doctor hasn't indicated that, then then you should consult with your doctor before you do anything. The best ways to protect yourself against COVID-19 right now are the ones that we've talked about. Mask wearing, physical distancing, and being mindful of whom you're interacting with. Vitamin D may later in the future prove to be of some benefit, but we're not there based on the data right now. So that's where we're at for the afternoon. Before I turn things over to the commissioner for any closing words, I wanted to provide a really quick update. It was asked earlier about the number of primary and secondary cases that are associated with the Waldo County outbreak. For everyone's awareness, right now, of the 60 cases, 34 are considered to be primary cases and 26 are considered to be secondary. Primary indicates that they attended either the fellowship event earlier this month or a worship service at Brooks Church. A secondary case is someone who came into direct, close, sustained contact with a primary case. So that's the numbers there. Commissioner, I'll turn things over to you for any closing words.
Thank you. I would like to end where we began, talking about health coverage. Health coverage matters. People who are uninsured tend to skip medicines, they delay care, their outcomes tend to be worse, and their risk of early and unnecessary death is higher. From the start, Governor Mills has worked to, on her first day in office, expand Medicaid, which has provided coverage to 62,000 people in the state of Maine, which has been a godsend during this pandemic. Her first bill was LD1, which codified the Affordable Care Act's pre-existing condition protections to ensure that somebody with diabetes or asthma or now COVID-19 is not denied health care or health insurance due to that pre-existing condition. Now, today, we're announcing new options for people to find affordable private health insurance through coverme.gov. It's more affordable than you think. Check it out, coverme.gov. Thank you so much.
Great. Thank you so much, Commissioner Lambrou. Thank you all for spending part of your afternoon with us to hear the latest on COVID-19 across the state of Maine. We look forward to joining you again on Thursday afternoon. Until then, as always, please be kind and take care of one another. We'll talk soon.